All right. Well, good afternoon, everyone. My name is James Gilbreath. Today, we are going to be talking about finding health statistics. So we're going to differentiate. Everyone is coming in, to a webinar with different information. So I'm going to start out differentiating between a statistic and a data set. We're going to identify potential sources for statistical information, both within and outside of library resources. I'm going to describe census population statistics, and we can brainstorm some solutions for unavailable data. If anyone has, at the end, if anyone has statistics they're looking for and has been having trouble finding them, maybe we can brainstorm some solutions for that. What is a statistic? So I always like going back to the original, to the Oxford English Dictionary. A statistic is a statistical fact, statement, or piece of data, or a datum, I suppose. And statistics are such facts or data collected and classified or analyzed. So statistics are a group of individual data points, and we can compare that to a data set, which is a collection of data. So oftentimes, or a question I've gotten a lot as a reference librarian here at Lister Hill is, are folks looking for data sets to support a particular thing they're trying to do? And sometimes you don't need a full data set if it's an assignment that needs data set. That's something different, of course. But sometimes you could find a particular statistic or set of statistics that will work. So what's the difference? A statistic is a singular datum, and it's usually used to support or prove a particular point when you're making an argument. Whereas a data set is a collection of data used for statistical analysis, and you may be able to pull, after doing analysis on it, individual useful data points from that to support whatever you're researching or whatever it is that you're arguing. So, census statistics. So in my experience, what folks tend to look for the most are really statistics related to census type data. So census statistics in the US, the census is a general, the census is taken every 10 years and it's a snapshot of the entire population of the US at a particular point in time. But census statistics in general are collected from a large overall population, include general demographics, age, gender, race, ethnicity, may include some social information such as religion or language, employment, health information. Our census statistics are collected by the U.S. Census Bureau through the U.S. Census and American Community Survey, and so on. There's several different ones they run. It's freely available from the U.S. Census Bureau, but it can be hard to navigate the built-in tools that they have. So census data is also findable and manipulable in library databases like the ones I'm going to be showing you. So in terms of library resources that we have that have health statistics in there, the first one I'm going to talk about is called Statista. Statista is a database that contains multidisciplinary statistics, facts, and market data. Statista was originally developed as, and I think its main purpose is intended as a business resource. However, the researchers at Statista pull in all sorts of things. And the way Statista works is the researchers go out, find reports in different industries, different markets, different fields of information, compile those, pull out individual points, and can put together dossiers and reports on different topics. So I'm going to pull up Statista and we can look at, a couple of things. So this is Statista. To get to these databases, you're going to go through the library website and you're going to go to either this database's link, or if you go into research, you can get to the database's link there. And you can just browse to S, or you can look up Statista. Empowering people with data, insights, and facts across 170 industries and 150 plus countries. So, would anyone like to shout out something they would be interested in looking up? I like live searching because it gives you more of an idea about how things actually work. So I don't have anything prepped to look up. Anyone want to shout something out? I can also check. Nothing in chat. Okay. Uh, electric
Okay.
vehicles. Oh,
Hello.
go ahead, please.
Can we look at maternal mortality in women of African American descent?
Absolutely. So, looking up maternal mortality in Statista, there is, for that one specifically, and you can actually get a little preview looking up at the tabs here. When we get to policy map, I will say policy map is going to be good specifically for that one. But we'll see what Statista has to say on it. And it is running a little slow for some reason right now. It's really thinking about it. So things that Statista will give you, when you do a search, it will give you results that have individual, so a statistic. So we have individual statistics pulled out. There's also, they have what are called topics. So they group things together. And they're also dossiers. So the dossiers are on a particular topic, a bunch of things that are compiled that the researchers have identified and put together. I think you can actually purchase if you don't have, for example, institutional access to Statista. I believe you can get access to them by paying for them, and they're pretty expensive. So this is a really nice resource that we all have access to. So here is births in the US. Wow, it's running really slow today. Statistics and facts. Let's see. Teen births, type of delivery. Okay, unfortunately, that one didn't actually have maternal mortality. How about African American United States? Neonatal and postnatal mortality rates in the US 2022 by race and ethnicity. So when you click on one of these statistics, it gives you nice interactive graphic. You can download it in a variety of formats. So, if you're sliding it right into a PowerPoint slide, you can download it that way. It gives you a little more information about it. But my favorite part, and why I think Statista is really useful, is it gives you exactly where the information came from. So this is infant mortality in the US 2022, data from the period linked birth/death infant death file page 10. And if we open that up, it takes us to the report that they got the information from. So that's specifically why I really like Statista, because when you go back to the original source, you can potentially find, well, it's always good to go back to the original source anyway, but you can potentially find other related data that's relevant to what you're researching. So you can see there's not a lot here. We do have a couple of points on specifically the topic at hand, but Sometimes for health information and health research kind of stuff, it doesn't have the best. It kind of depends on what the topic is. Whoops. Let's get back to where we were. Okay. Uh, our next resource is called Simply Analytics. It is a dynamic, interactive tool that combines demographic with geographic data, and it can produce comparisons and reports. So while Statista gives you reports and dossiers with the information you may be looking for, Simply Analytics is a tool that can give you a lot of other different kinds of reports. So the one I have used the most is maps, creating thematic maps. But we can also get comparison tables and ranking tables, some other things like that. So I'm going to create a new map because I think the geographic nature of Simple Analytics, and when we get to it, policy map, it can be really, really useful depending on the kind of research you're doing. So I'm going to do a little bit about Simply Analytics here. The channel that this webinar will be uploaded for you to view later. If you view other content on that, if you go to the other videos on that channel, which is actually my channel, you can find a tutorial on using, or a video tutorial on using Simply Analytics that goes a little bit more in depth. And thank you to whoever started transcribing. My apologies, I should have done that earlier. So we picked a location, and now we're going to add some types of data. So looking through here, as I mentioned earlier with census data, we have population, age, gender, race, and ethnicity. I have some social stuff like education, language, ancestry. Again, Simply Analytics was built as a business tool. So we have things like market segments, which is, frankly, that's wild stuff. I used to work with a lot with advertising students, and the prison data is pretty bonkers. Uh, we have consumer data, and then we have health. So let's look at cigarette smoking. Why not? So as you're looking, as you do your search and you're looking, you can get an idea for where this data came from and what kind of data it is. So we have consumer expenditure estimates, Simmons Local. So Simmons is a company that does consumer and consumer surveys, and will look at expenditures and consumer behavior and stuff like that. And Simmons Local is just the geographic localized version of that data. Let's see. I don't really care about the brand. Let's try smoking instead. Consumer expenditure estimates. Let's do tobacco products and smoking supplies. All right, I'm going to say done. So I'm looking at Birmingham, and we have, oh, this must be total population expenditures on tobacco and smoking supplies. So if I had looked at the data on that, it would have told me that. But now we have an interactive map with this data. It is broken. This data is from 2022. It's broken down by zip codes. We have the yellow outline. Since I looked at Birmingham, these are the city limits, which are always fascinating to look at. And I'm going to make that go away. There we go. So things you can immediately do. So we can edit the legend, and we can change the classification method. So you can look this up, but Quantiles tries to break the the breakpoints down into sort of even points, whereas natural breaks, local and national, it's a little hard for me to describe. I'm not a statistician. But when you're looking at a local area, I feel like natural breaks is a little more evocative, and can give you the ranges tend to be more reasonable. And it's also dynamic. So as you zoom in and out, whoops, we can see data by county. So we were at zip codes, and as we scroll in, now we're looking at census tracts. So if you're doing or planning to do research that may be hyper-focused on a particular area, some of this data is available as close as like block groups within census tracts. So that could potentially be useful for you. Um, Interesting. Well, this is going to correlate with income too. So perhaps unsurprising that Mountain Brook is the census tract that spent the most on tobacco and smoking supplies. Um, but, so for other types of data, if we look at health, um, so say, for example, percent health insurance coverage by age. Oh, and if you want more information about a particular uh, set of data, you can click on this button and view the metadata about it. So this is community demographics, health insurance coverage by age. It's from 2024. This data is from Simply Analytics and the U.S. Census Bureau, American Community Survey, and Puerto Rico Community Survey. So this is more um, census type data. So it's freely available from the U.S. Census, and Simply Analytics did something to it to make it more usable. So we click that. Percent health insurance, no insurance coverage. Well, it's good that most of the area is 0 to 1.2%. And if we zoom out, looking at more census tracts. Okay, so that's pretty much Simply Analytics. Uh, I really, if you do work with populations and that sort of thing, I really recommend taking some time and just playing around with Simply Analytics, getting used to it. Oh, you can, of course, export the maps you create, the tables you can create as well. The comparison tables you create compare whatever information you pick across cities and can compare to the US. So there's a lot you can do with Simply Analytics. It's very user friendly. It just takes a little bit of getting used to using. Okay, so Statista and Simply Analytics are, I would say, the two big library provided databases that you'll have access to that will have information for you to use. But of course, there are a ton of non-UAB libraries resources. The first of these is called Policy Map. Now, this is a subscription database, but access is provided by the Lister Hill Center for Health Policy. So it's similar to Simply Analytics, but includes federal guideline relevant statistics, and there are some UAB curated collections of statistical information. So I have the direct link to it here, but for instructions on accessing it, and setting up an account and that sort of thing, you're going to want to go to the Lister Hill Center website and click through and look at that. So as we look at Policy Map, the interface is a bit different, but it's functionally pretty similar to Simply Analytics. So I can enter a location. So it zoomed in. For data, I can look up maternal mortality. So, looking at what we have here, so rate of infant deaths per 1,000 live births among infants with mothers who are Black or African American. This is from the CDC. So I don't know if Simply Analytics does a lot of extrapolation, um, but Policy Map will absolutely tell you if the data you want at the scale you want is available or not. So, for example, um, this is in 2021. We can go back looking by year, and the options are shaded by county as of 2010 or state. So, whoops, clear that out. And a lot of these have, it's taking its time to load. There we go. And for whatever reason, a lot of the counties in Alabama are saying insufficient data. Click map to show more. It's insufficient data. Okay. So I'm curious if I actually haven't done this comparison. I have not tried, and I won't bore y'all with doing that right now. But I'm curious if I looked up this particular datum in Simply Analytics, if it just wouldn't be there, or if it would, or if they have some extrapolation methods for getting other data around it. Um, but in Policy Map, you have, similarly to Simply Analytics, demographic information, census type data, stuff about housing, homelessness, subsidized housing, stuff on lending, quality of life, economy. Under the curated collections, we have information on social determinants of health. And so I imagine that the Lister Hill Center for Health Policy asked, this may have been available already, or the Lister Hill Center may have been like, hey, can y'all put together this set of social determinants of health data for us to use? Um, Again, you can download the information, you can build reports. So it's a very powerful tool. And for health and population research, this is going to be a little better to use, but some of the data will have limitations based on, you know, the original research that was performed and where that data is coming from. So more broadly speaking, we have resources like the National Center for Health Statistics, which has all sorts of data and data analysis tools built in. So when you start looking at places like the National Center for Health Statistics, sometimes you can find a particular statistic that you're looking for, but oftentimes you're going to be getting big data sets. And sometimes the websites will have tools built in to analyze the data. Other times you will have to download the data and have your own statistical tools to manipulate and work through that data. So, for example, in addition to data access, the National Center for Health Statistics provides several tools to assist researchers and analysts in using our data. So like the compressed mortality file, tools and frameworks for analyzing injury data, and so on like that. And there are some survey specific tools. And we actually have a library guide on health statistics. So if you're looking for So if you're looking for a particular statistic or broadly speaking, types of data, we do have a guide for that. It still needs to be updated. One of us still needs to update it. But looking through here, we have links out to a lot of different places where you can get statistical data. We've got stuff from international sources like Eurostat, World Bank Health Statistics, health-related statistical resources, so like AHRQ, American Hospital Association. Oh, that reminds me, actually. So under the Lister Hill Center for Health Policy Resources, I'm reminded that, here we go. We do have access to, I think it's AHRQ data. Yep, American Hospital Association data. I've gotten questions about that a lot in chat. So, but this is how we have access to it through the Lister Hill Center for Health Policy, and it's in WRDS, which is a statistical database. Incidentally, we also have access to UAB Grid and Meltwater through the Lister Hill Center for Health Policy. So these are some other resources you can keep in mind. We have statistics by health topic. We also have links to Alabama statistics, so by state and by county and city, and links to some analysis tools as well. So take a look through the guide, and you may be able to find some other good resources as well. So, talking about finding data sets, researchers will say, hey, I need help finding a data set about this. And oh, and policy map. So, oh, your chat question just disappeared. So, Kimberly, who is with the Lister Hill Center for Health Policy, has joined us. Good to see you. Yes, we talked about policy map a little bit before you joined, but so thank you as well to the Lister Hill Center for providing us access to this. Um, Instantly, Kimberly, I'm going to be reaching out to you soon about something. And I will be asked like, hey, can you help me find a data set on this? And the answer is going to be maybe. So when you're looking for data sets, the first place you would want to go is data.gov, and just to see, because the federal government is going to be the biggest purveyor of data sets that you may want to use for research. So, and it's really data sets about anything, you know. So again, from Dr. Hendrick's suggestion on maternal mortality, there are 23 data sets with information. Demographic and health surveys from DHS. We have some federal, we have city, so City of New York data. Here's data from CDC Wonder. Here's data from the state of California. So in addition to federal data sets, wow, red king crab fecundity and embryo and larval quality from NOAA, Department of Commerce. So really, there's data about all sorts of things. There are all sorts of data sets that you can find through data.gov. And really, it's just a matter of poking through here and seeing what's available. So something like maternal mortality, yeah, there are absolutely going to be data sets to support that. What I often see is are researchers looking for data sets that are very particular to their research question. And those may or may not always be available. Another good place you can look is Google actually has a data set search. So just using the example when they have national long-term water quality monitoring data. So when you search for something and you're looking at the data sets, it'll tell you the name of the data set where you can find it if it's been cited, which is really interesting. I don't remember seeing that before. When it was last updated, the license and the description. Um, and if you click through, we have the data and resources in English and French. And then we have, okay, so these are in CSV, so these are at least viewable automatically. Some data sets come in data types that you can't view immediately, that you would have to use um, another program to view and to access. For example, like Stata or something like that. Uh, but much like data.gov, you can find data sets about all sorts of stuff. Like hospital-acquired infections. So the first one is a hospital-acquired infection control market report, industry analysis, size, and forecast, which is interesting. Forecast through 2030. I'm guessing these are all freely available. No, some of these you do have to pay for it. Okay, so that's useful to know. So sometimes you may be able to find the data set, but not actually access it. We get asked sometimes, can the library obtain data sets? Uh, and the answer that I've usually gotten is no, but it's not impossible. Um, so it's not something we could get through interlibrary loan. Um, And I think the library would be hesitant to start purchasing data sets for individual researchers for scalability purposes, if nothing else. Um, but the answer may not always be no. And that's no as I understand it. I haven't asked in a little while because it hasn't come up. So if you need a data set purchased, you can add it. I will say it never hurts to ask. Um, but the answer may be no. We also have data sets from the World Health Organization, and then, oh, American Hospital Association data. There it is. So things you should think about with data sets. So can the data be exported, or do you have to view it through a tool on their site, which is something that can happen? What data formats are available? So we saw .csv. So with that, you can use it in Excel or an open source version of that, or it may be like an access database, or you know any of the many kinds of database and data formats that may require proprietary software to use. And then, what additional software do you need when you're doing your analysis? So brainstorming solutions. So sometimes the data you need may not exist. Um, It may not exist because the researcher who's asking is the first person to ask that question, and so no one has gathered that data previously. Um, or it may not be available. So things you can do. You can always search literature on the topic and see articles on that subject. What are they citing? Where are they getting their data from? And then pursuing those as avenues for potentially getting the data. Figuring out who to contact. I was working with a student who was able to get data sets from, I won't out the person by saying specifically they were able to get data sets on this topic from surrounding states, but the person who is in charge of it in this state would not share it. So figure out who to contact to get it, but then you still might run into roadblocks. Maybe you can approximate the data. So if the particular data you want isn't available, are there other types of data or other maybe similar populations where the data is available for it? And depending on what it is that you're trying to produce, that may or may not be helpful. So like if it's for an assignment, that may work fine. If you're getting it published, that may not work. And you can always ask your librarian. So if you ever have information needs, you can always ask a question through chat. We're available 9 to 5 Monday through Friday. But for your particular area, you may want to reach out to your relevant librarian. So I am, for example, the liaison to the School of Nursing. So if you're in nursing or doing research related to nursing and you need help finding data or statistics, you can just reach directly out to me. You can shoot me an email and I'll be happy to help. And these are all our liaisons, both in Lister Hill and over in Stern. We're all very happy to be of assistance. So if you have any questions after today, please feel free to contact us, chat, or shoot me an email, and I'll be happy to be of assistance. So does anyone have any questions for me? And also, if you wouldn't mind, if you could do a quick session evaluation, I would greatly appreciate it as we're thinking of questions to ask. Or if you're stuck on something in particular that you need help finding. Or if you are a researcher who's had trouble finding or getting access to a particular data set before or statistics, um, what did you do? What worked for you? Is there a course number we need to put in for the survey? You could just put like health statistics webinar or something like that. Thank you. Okay, that's an excellent question. Anyone else? Or Kimberly, since you're on and since you are in charge of research for the Lister Hill Center for Health Policy, do you have any tips from experience for finding, I guess, especially state level related data that may or may not be available?
Yeah, it can be hard. Most of our data comes from AHA, which is why we have access to it. But yeah, state level data in particular in Alabama is just a different kind of beast. So I wish you luck if you're trying to.
Thank you. Thank you for that, Kimberly. Any other questions? Any other thoughts? Well, in that case, thank y'all very, very much for coming today. I hope this was useful to y'all. I will be sending out the recording and slides sometime in the next day or so. So again, if you need any assistance, please don't hesitate to ask. We are here to help you and to help you succeed in your endeavors. So I hope y'all have a great rest of your week. Stay warm. Y'all take care.